when you look at the U.S. healthcare, you were talking about this before a little bit about how things are trending. The thing that always gets stuck in my mind is I always hear that the U.S. is 2 to 3 times more expensive per capita, or maybe not more expensive, spends 2 to 3 times more per capita than other countries in NATO. So we're not talking countries in different economic situations or different access to healthcare, countries in NATO. Why is that? What is happening with the U.S. healthcare system?
So if you think of the average American's just preferences and styles or what they're accustomed to in their daily life, as Americans, we want choice. You always want to have choice. And as Americans, you also want to have things done very quickly. So choice and patience are two things that are kind of innate to being American that you may not see in other countries. So in a lot of other countries, especially kind of European or NATO countries, they could have socialized medicine. So your healthcare will be free, but you're going to be assigned a doctor in 63 days and you have to show up on that day and you're not going to know who your doctor is that day. And nor are you going to have the ability to say, hey, I want this. Whereas if you take an American and they need to get a total hip done, so they need a hip replacement. With today's technology, they can search 3 or 4 biggest brands. They can read testimonials. They can look at any lawsuits or anything. They can find all those things out. They can also research their doctor. Hey, this doctor went to Harvard Medical School, did their internship at Rush, and they have done this procedure 700 times a year, and this is the doctor I want to go to. So for that optionality, we pay up for it. And there's also a markup. I'm sorry, Mark. There's also a markup on products because, yes, the unit cost on an item might be $25, and the company could sell it for $250. But a portion of that has to go to future research and development, because if you're not going to innovate new technology, you're going to be left behind. And so the research and development budgets for a lot of these med device companies is astronomical compared to other spaces or sectors.
Okay, but comparing it to other countries in the same sector, are they doing less R&D? And the narrative you're telling is not the narrative we usually hear in the news. The narrative we hear in the news is, our system's broken.
The answer, yes.
Right.
There is a certain element of our system that's broken. To answer your question directly, I think we're paying up for optionality. A lot of the rest of the world are paying lower price points for items than we may be, but they're not. A lot of these companies are American-based medical device companies. And so when we're creating a lot of the technology here in the US, we're eating some of that research and development costs for the rest of the world.
Got it. So we're paying more for better quality, and we're investing in the future, whereas other countries may not be, that part of the supply chain. But they might just be getting our technology and not paying the same margin because it's not market there.
Yeah, 100%. And the other part of that, though, is, for me, it comes down to 2 scores. And when you talk about healthcare, I think people lose sight of the 2 things. There's a clinical success and there is a patient satisfaction success. And so clinically, we could have a great outcome. But if the patient's not feeling like the pain's gone away or the issue's been resolved, then the outcome is a failure. Because at the end of the day, the patient has to be happy about it and be able to go back to their normal daily life. And so when you look at outcomes, US outcomes are not as promising as they used to be. We still have great medical care. And you're going to be with a physician that you like, arguably at a facility that you like, getting the products that you hope you get. But even with those options, the actual success rates are not that much better than the rest of the world. And so it shows you that we're innovating technology maybe unnecessarily.
Yeah, so how does that square up? So we're spending more for better results. We're getting more optionality, but we're not getting better results.
Yeah.
So the money is going into the fluff of picking?
The money is going
Or it's going into R&D, or it's going into shareholder payouts. Like where is the money going?
I think the money's being split up in so many different directions. It's not a direct linear progression on where to follow it. Some of it's going to compensation for the staffs and the clinical teams that are providing care. Some of it's going to hospitals and them kind of augmenting loss leader procedures. Some of it's going back to the med device companies. Some are going to developers and marketers. So it's just, there's so much spend in the US on healthcare that there's so many hands going into the pocket. And it's hard to know exactly where it's all being leveled out.
But someone's going to be able to do this math. You may not know it offhand, but numbers are numbers.
Yeah.
McKinsey, Bain, some of the consulting firms. Someone needs to go out and dial this in. I'm sure they already have. Okay. What are the areas of healthcare that are the most dysfunctional operationally? Because we're talking about, you're not implying it, but when I think of healthcare, I do assume there's a fair bit of inefficiency. Now, maybe that's not the case. And so maybe I should start there. When I think of hospitals and all that, I just assume they're wildly inefficient. If that's not the case, something's different. As a business operator, it feels like chaos when you walk in. The scheduling's not right. It just doesn't feel the way I would run a company. So, first of all, do you think healthcare is inefficient in its delivery of the service, or do you think it's efficient overall?
I think it's incredibly inefficient.
Okay. I assume that was an assumption,
Okay.
like obvious, but I was questioning myself there for a second. All right. So if it's inefficient, where is the source of the dysfunction? Why is it inefficient?
That's a great question. And I actually, I wrote an article about that just recently. I think when you look at really successful organizations, and let's take healthcare aside and just talk about industry, any business, those companies that are very horizontal in their organization are usually able to address chaos, pivot, shift, make decisions, and evolve much faster than those vertical organizations. And so in healthcare, you've got this hierarchy system that's developed from the time that they're a first-year medical student. So the first years are devalued to the fourth years. And then when they become a resident, an intern year versus a residency year, there's a hierarchy there. And then there's a senior resident or chief resident as opposed to a junior resident. And then as they go through their fellowship, their first-year fellow versus a second-year fellow, and new attending versus a tenured physician or surgeon. So you have this whole ecosystem that's based on class systems. Doctors are the top of the food chain, and then nurse practitioners and physician assistants and nurses and techs. And so you have this pecking order and class system that has shown to be unsuccessful in every other area of business, but it's still the framework for healthcare. And so if you have to make a pivot or change, what happens in most healthcare societies or institutions now is you have 3 or 4 levels of decision making to get to until someone pulls a trigger to change something. And that doesn't work. I mean, everyone else who runs a business knows hire great people, empower them to make choices, and make sure they're incentivized that they feel the business is as much theirs as it is the owner's. And if you can do that, you can adapt and evolve and address marketplace shifts. Healthcare can't do that. For example, I had a situation early in a pandemic where a large physician group needed hand sanitizer. And this is a time where you and I couldn't get that 1.5 ounce jars from CVS. And they needed 1,000 gallons of hand sanitizer. And so they called me and I said, hey, I can get you 1,000 gallons of hand sanitizer drop shipped in 96 hours. I then had to wait 3 days for the final decision maker to make the yes, or to give the yes so I can place the order for them. And in the course of those 3 days, the 1,000 gallons evaporated.
Right. Because this was COVID and there was a shortage of everything.
And so, I think when you run a vertical organization or a hierarchical organization, you're setting yourself up for certain systemic issues. And that's all we've ever known in healthcare.